Patient-centered care coordination is a core professional standard and competency for all nursing practice. In our nurse transition coach model, registered nurses are skilled leaders in the care coordination process essential to patient care outcomes, facilitating effective interprofessional collaboration, and decreasing costs across patient populations and healthcare settings. Today, we will show you how our model works to achieve these outcomes with real solutions. The Transition Coach's Day begins by receiving a risk stratification report that identifies the highest risk patients for hospital readmission. It is imperative to effectively allocate resources by identifying the patients at highest risk of return and tailoring follow-up accordingly. Once those patients have been identified, the transition coach will visit them to establish a relationship, identify their needs, and begin education. The rapport established between the transition coach and patient enables them to collaborate in setting realistic goals.
Okay. Well, I'm here to tell you that
each patient receives a packet of information that reinforces what they have learned and serves as an ongoing resource to them. The information they obtain is simple, clear, and written in the patient's preferred language.
Okay, anything that you want, I'm here for you. Great.
The hospital interprofessional team continues this education and care plan throughout the patient's stay in the hospital. The nurse coordinates communication within the team to ensure effective and efficient care. Bedside handover to new caregivers between shifts includes the patient, and multidisciplinary rounds occur so that goals are achieved. Many post-discharge adverse events are related to medications and are the top cause of hospital readmissions. In the nurse transition coach model, another important member of the team is the pharmacist. In an effort to make sure patients have prescribed medications before they are discharged, we work with our on-site Walgreens to get medications filled and delivered to patients before they leave the hospital. The pharmacist visits the patient at the bedside with the medications, reviews the medication list, and addresses any questions. After 72 hours, the patient will also receive a follow-up call by the pharmacist to check on the patient, review potential side effects, and assess medication adherence.
Aaron, Mary has been discharged.
At the time of patient discharge, the unit secretary schedules the primary care physician follow-up appointment to occur within 5 days of hospital discharge. Primary care physicians play a pivotal role in the follow-up care of patients once they leave the hospital, and this leads to a lower risk of readmission within a 30, 60, and even 90-day period.
To schedule a follow-up appointment for Mary.
A discharge log is kept for the unit secretary to use for tracking purposes. We assist the patient with scheduling their first visit to assure that there is a collaborative handoff between the hospital and their physician, and oversight of their care continues while at home. That handoff also occurs between the transition coach and the home care nurse. The nurses discuss the patient's personal goals, education needs, medications, and clinical care so that there is a seamless transition from hospital to home.
Okay, sounds good.
The home care nurse arrives at the patient home the day after hospital discharge to perform an assessment of the patient. By visiting the patient's home, the nurse gains insight into the patient's living situation as it relates to their health needs. The home care nurse communicates questions or concerns as needed to the transition coach, physician, and pharmacist. In addition to providing clinical care, they can also help the patients and their caregivers navigate through their ongoing needs, such as understanding their diagnosis, their medications, and advocate for resources they need at home.
Erin, I'm calling to schedule a follow-up appointment for a patient that's being discharged today.
Even when a follow-up appointment with the primary care physician has been made,
Do you have any transportation for
patients may have limited access to transportation,
I don't have my car here.
which can cause appointments to be missed.
Certainly set up arrangements for you.
Our nurse transition coach model includes access to a hospital transportation van at a low cost, as long as patients are coming to one of our hospital campuses or affiliated physician offices. Providing this transportation has reduced the number of missed follow-up appointments with physicians.
Car's ambulance.
The transition coach will follow up with the patient by telephone 1 to 2 times each week to see how they are doing and whether they are meeting their personal goals. It is also an opportunity to identify if physician appointments were kept, that there is medication adherence, and to review important signs and symptoms that require attention, such as weight gain or shortness of breath, or if they have any other issues, such as the inability to afford medications.
Still the same.
The transition coach will contact the primary care physician and other team members to discuss next steps and even connect them with other community resources. If necessary, after 30 days, the transition coach refers the patient to a complex case manager within the hospital system for further follow-up. There are times that despite these efforts, some patients' health continues to deteriorate and they return to our hospital, usually through the emergency room. When the patient arrives in the ER, an alert is triggered to all readmission team members, identifying that the patient has returned. An interprofessional team is deployed to the patient's bedside within hours of admission to quickly assess, treat, and determine whether they need to be readmitted.
You said it came on fairly suddenly.
Oftentimes, patients' health issues can be resolved, and they can return home quickly.
Okay, thanks.
A key part of continuous improvement is evaluation of the program. Our readmission team meets monthly to discuss the root cause of each hospital readmission, to determine if the admission was preventable, and to make rapid cycle improvements to the model.
The readmissions from ER.
Often, this means making changes to hospital processes, navigating through complex systems, and mobilizing community resources. Care coordination is challenging for individuals who have complex chronic conditions that may be lifelong and require special services. In our current healthcare system, there is a need for systems that support better health outcomes while reducing costs. The Nurse Transition Coach model and the care coordination it provides has been a way for McNeil Hospital to meet these goals, reduce readmissions to the hospital, and establish trusting and mutually rewarding relationships with our patients.